impacted. Now, we know across the country, Indigenous peoples, First Nation, Inuit and Métis communities, they feel like they're being left out of the government's response to the toxic drug crisis, and they're seeing their communities suffer from loss and increased crime. In fact, last week, Alberta just announced that First Nations and Métis people represent 20% of all apparent unintended opioid deaths, despite representing only 3.4% of the population. Can the minister tell this House how Health Canada is working with Indigenous services and Indigenous leadership across the country to take a healthcare-focused approach to the toxic drug crisis? And is this minister willing to intervene if Conservative premiers like Danielle Smith or Scott Moe continue to let preventable deaths from toxic drug poisoning continue at this rate?
The Honourable Minister.
Thank you, Madam Chair. And I'm going to push back a little bit here, because the CDSS and the renewed CDSS actually is our plan in addressing the crisis. And it is, in it, we talk about a really holistic and interdepartmental approach, which means I'll be working with my colleague, the Minister of Indigenous Services, working with the Housing Minister, because we know we need to pull all the threads together in order to address this crisis. There's no one-stop fix for this, as the Conservatives would like to think that it's treatment, and treatment only, and forced treatment at that. The truth is we need many, many tools in the toolbox to address this, and it will take time, because we need, the drug crisis is not new, Madam Chair. We need sustained long-term strategies, which is exactly what the CDSS is about, which is exactly why we're investing $150 million in an emergency treatment fund right now, which is why the SUOP, which is over 380 projects across this country, have been funded in communities, will continue to do this work.